a child psychiatrist is a specialist in mental health of children and adolescents, right? So we work with alongside other professionals and such as psychologists and speech and language therapists or family therapists, and each of us has a different kind of area to work. So child psychiatrists usually do the assessment of mental health conditions in children, right? So we are the ones to kind of diagnose or to say whether or not the child is, the symptoms or the presentation is developmentally appropriate, or there's a psychiatric condition, for instance. Kind of two main blocks, if you want. So one is what we called external behaviors, if you want, and then we have conditions in which, like, the behavior of the child is the problem. So we have, for instance, children with Oppositional Defiant Disorder, children with ADHD, children with autistic spectrum disorder, and then we have some other conditions that we call it internalizing disorders, and are more like less behavioral, if you want, and then the child is suffering inside. So we have, for instance, anxiety, depression, and other kind of like variants of anxiety, depression. So that would be the other kind of block. In general, we can treat like enuresis, we can treat addictions to substance, we can also treat like psychosis. So there are a variety of different psychiatric disorders that we can treat apart from the ones that I mentioned. Uh, 66% of mental health problems start before the age of 14, and I think 75 before the age of 19. So it's like a big proportion of them. And the other numbers are, for instance, 1 in 10 children are going to suffer from mental health problems, from a disorder, okay? If we take into account that, so that would be a recognizable and disorder as classified by diagnosing systems. But there are some children who present with symptoms that don't qualify for the diagnosis, but still they present with some symptoms of anxiety and depression, and so then it might be up to 20% of the kids. So mental health problems are not uncommon. We think, in general, it depends on the disorder, right? We know that some disorders have more, the genetic component is stronger. And we know that some others, like the environmental or the events in life, might be more like a stronger factor. But it's usually a combination of both. So, for instance, we know that children who suffer from mistreatment and domestic violence and incidents of that type during like early in life are more predisposed to suffer from anxiety and depression. So we know that. But then we know that those who have a genetic predisposition in this serotoninergic gene, so it's a gene related to this serotonin, which is a neurotransmitter in the brain, those who have this particular predisposition are going to be more likely to suffer from depression and anxiety than those who have suffered from mistreatment and domestic violence and who don't have the genetic predisposition. So Usually it's a combination of both, I would say. What I think is essential, right? And it would be ideal that all the kids could have the same like nurturing environment, and that they're not exposed to things that might be really traumatic in their lives. So we know that children who have been exposed to trauma, as I said, they are more likely going to suffer from depression and anxiety. So ideally, if we could minimize these type of factors, we know that this could have a really positive impact later in life, and even in adult mental health as well, not just in children and adolescents, but also later on in life. It is important to get diagnosed because most of the times the clock is our enemy. So the longer the condition persists, the condition is going to be more severe, and usually the child has had more impact in their lives. And so the earlier we treat the condition, the prognosis is much better. And we know that, like for instance in psychosis, the earlier we treat the psychosis, the much better the outcome. We also know about depression and anxiety. The earlier we treat depression and anxiety in a child, the less likely the symptoms or the condition are going to persist in adulthood. So an early diagnosis is essential. ODD is Oppositional Defiant Disorder, and is a pattern of behavior in which the child is argumentative and defiant, and usually tends to not listen to the adults when they are asking him to do, or I'm saying him because it's more frequent in boys, but when they're asking them to do something, they are not agreeing, and they are quite fiery in a way. And as a result of that, they have a lot of arguments, or they might have arguments with other children. So that is the pattern of behavior that a child with ODD, Oppositional Defiant Disorder, has. In general, they're usually quite, at times, confrontational, and at times they're not going to be that obedient, right? So what you have to see is if the pattern is the normal pattern and is more, is happening more usual than in other kids at the same age. So you can see two kids, one who is like saying no from time to time, and the other one who's constantly fighting and saying no. And if you ask him to do something and he's declining to do so, or he's like kind of presenting a temper tantrum or being defiant, right? So, and he's constantly like this. It's not that it's a bad day for the child, it's the type of behavior that it happens most of the times, or it's more likely to happen in this child than in any other child. So this child might have ODD, right? OCD means Obsessive Compulsive Disorder. OCD means obsessions, which is like strong thoughts and worries in a child. And for instance, it can be around, he can die, or a member of the family can die. And then as a result of that, some of them can create some compulsions or stereotype behaviors. For instance, they might think, well, my mum can die, so if I wash my hands 3 times, then she's not going to die, right? and they have to repeat this behavior. It has to be 3 times. It can't be once. It has to be 3 times. Or if I touch the wall, then nothing is going to happen, right? And that the compulsive behavior reduces the anxiety, but what happens is that it tends to be maintained in the time, because then the child thinks, well, I have to do that every time I get worried about my mum, and then it can become like really kind of a vicious cycle that the child needs to repeat again and again, right? OCD is a type of anxiety disorder, right? So in general, there are so many anxiety disorders that are classified within anxiety disorders. So one is OCD, the other one is separation anxiety, the other one is PTSD, that most people like post-traumatic stress disorder. So these are types of, or social anxiety. The 4 of them are different types of anxiety, because the main characteristic is anxiety, the main presentation. Separation anxiety is usually more likely to happen in younger children. So it'd be something like the child who is starting nursery school or primary school, and they become really anxious and worried and agitated because they feel like when their family, their parents are leaving them at the nursery, they start crying or something, thinking that something bad can happen to the family, right? And for them it's really difficult to adapt to the new environment, and they struggle, and as a result of that they're anxious, they cry, and they find it difficult to adapt. And in some cases they might be thinking, well, something can happen to my mom, and I don't know if she's going to come and pick me up. Some of them might think, well, I don't know if it's like 5 o'clock and my mom is going to arrive on time to pick me up, and that causes them a lot of anxiety. But it's more common in younger kids than in adults. It's very common that people with autism struggle, and they might have anxiety problems in the form of social anxiety or OCD, or again separation anxiety. We know that they are more predisposed to, whether or not this comes from their own the difficulties to adapt to the environment, or whether their brain is predisposing them to suffer from anxiety. We don't know. It might be a combination of both, right? But we know that anxiety is more common in this population. In general, psychotic disorders is an umbrella that is considering different disorders, right? So we have, for instance, what people probably understand as like schizophrenia. Schizophrenia is a psychosis maintained in the time. It means like the symptoms are maintained in the time for a long time. But we can also have like a brief episode of psychosis in children, which is more common than schizophrenia, right? And sometimes it's as a result of stressors, anxiety, right? And usually the psychotic episode is defined by hallucinations, which means that the child is seeing things or hearing things that are not real. So the child might see someone like a man or a woman, or might hear things like the voice of someone or their own voice, and the voice might be commanding and might be telling the child to do things, or they might be commenting or insulting the child and saying, oh, you're really bad, or you're... So it's a combination of these two, right? And obviously as a result of that, the mood gets really affected because the child is really struggling and anxious and most of the times depressed because it's really hard. We usually see kids or young people who use multiple drugs at the same time, and they use in a way that is recreational, like most of the times, like going out with friends. And drugs are incredibly cheap for them, and the access to the drugs is really easy. And for them, it's really easy to pay like £2 and to get a pill. And they prefer doing that, for instance, buying a glass of wine or beer. So the accessibility to drugs is becoming so easy that that is making them much more prone to use the drugs. The use of drugs change their lives in the way that they can become much more aggressive. They can have problems at home or at school. So sometimes you might need to consider drug use in a child or adolescent who has never had problems at home, and then suddenly they start like being really aggressive or confrontational, and they don't need to be depending on the drugs. Just the use of drugs during the weekend, the way that they use the drugs and the quality of the drugs and the way they combine the different drugs is just harmful enough, and they affect their behavior and their cognition as well. Well, it affects differently because the brain is developing in the children, right? So the brain is more sensitive to everything, and substances that might have an impact in an adult, in a child, is going to have 3 times the impact because it's going to affect the brain development, the mood as well. So the way they're going to react is much more intense, if you want. Well, we know that every time that young people get drunk, the loss of neurons is massive. It is as if the brain has aged like a year or so. So it'd be the equivalent of aging like a year, and then they losing neurons that are cells that are not going to be regenerated. That's very important. So if you get drunk every weekend, that means that your brain is going to be affected every weekend, right? So it can have a massive impact in your brain. Sleep is the process or the time during the day when the brain and all our cells are regenerating. And that happens for our skin, for our brain, for the rest of the organs. We go to sleep, and we know that there are metabolic changes in which our cells get renewed, and therefore it's very essential that we get the right amount of sleep, and that sleep is correct, not just like. So the quality of the sleep is correct, right? So we know that when the sleep is not the right quality or not the right amount, we are more predisposed to a number of physical things like diabetes, obesity, cardiovascular disease, and also mental health problems. So sleep is essential in our lives. Sleep is, on the one hand, is like a symptom. So it might be a symptom. We know that when young people suffer from anxiety or depression, one of the first symptoms is like sleep is affected. And young people go to sleep, they can't sleep properly, they feel tired the following day. And that happens with most of the most of the psychiatric conditions, right? So in that respect, it's a marker, if you want, it's a sign that something is kind of not right, right? And then on the other hand, if sleep is not correct, if we're trying to treat a condition like, say, depression or say psychosis or whatever, but sleep is not maintained in the correct manner, then it's very difficult that the young person can recover. So we have to kind of insist on sleep, and we usually say, like, we insist so much on sleeping properly, sleeping enough for the brain to get fully recovered. Stress is something that is normal for all of us, okay? We all have moments in our lives that we feel more stressed out, and we feel like it's our brain and our body. What happens is, like, there are some hormones, one of them the cortisol, right, that are released, and the cortisol is preparing our mind and our body to be alert and to be able, it's kind of like a mechanism in which we are ready to fight or to fly. We call it, like, we are ready to start, like, to go in action and to start, like, moving on. However, if that is maintained constantly or maintained for longer than is recommended, then our brain switches off, and our body and our brain is going to suffer. Cortisol levels are really damaging our brain. That really kind of it'd be the opposite of the antioxidant, right? Is the mechanism in the brain is really damaging, and the brain gets impacted, and also our body, right? So if the stress is maintained, we're going to have consequences in our mental health and in our physical health, and it's what people can see, right? Like depression, anxiety, even psychosis, PTSD. Most of the time, some of them might have the origin in stress, like normal levels of stress or maintained levels of stress. It's very important because they have to recognize when they feel stressed out, right? And that they feel stressed out, and that they have to do things to compensate. And one of them is, like we were talking earlier, like about eating properly, about exercising. Exercise reduces the stress and the stress levels. So sleeping properly. So there are things that can be done, and also obviously having like a social network to communicate the stress, and to have like also the appropriate family support to help with the stress. So identifying things that might be stressful and being ready for it, and knowing, well, you know what, if I start to not sleep properly, what I'm going to do is I'm going to do this, or it's essential. Organic food in general are important because they are free of pollutants, and pollutants are substances that are going to affect our DNA, our genetic material, in a way that it can cause many illnesses like, I don't know, cancer and hypertension and any cardiac disease and everything. So we know that there are, the more contaminated the food is, the higher the impact is going to have in our DNA, and we're going to age much worse in general, and our health is going to be affected as a result. In general, diet can change behavior, right? It's not just with ADHD, but in general, like we know that children, the healthier the diet, the better for behavior. I'm not saying that the diet is going to change the behavior, but I'm saying it's going to help concentration, it's going to help with sleep, and then it's going to affect the whole behavior, right? So I would say it's really, really essential for children. There are many studies suggesting that in our kind of in the brain and also in our body, there are mechanisms of damage, and so we can call it insults or stresses. So every time that we have a damage, there are mechanisms trying to compensate this damage, and that can happen in our brain, as it is the case, like mental health, but it can also happen in every single part of our body, right? So the antioxidants try to reinforce the part of the body that is trying to help our brain and our body to go back to the previous level and to get over the insult or the stressor that is causing the damage, and it's going to try to repair the damage. So in that respect, antioxidants are really positive because they make our body more able to repair the damage. We know that our brain cells, the neurons, they have one essential part of our cells is the membrane of the neuron, right? It's very important for the cell to work effectively. And we know that fatty acids are components, very important components of the neurons. So the research started to investigate whether or not omega-3 and other fatty acids were contributing to mental health and how they could contribute to mental health. So there were some studies suggesting that, for instance, people who are starting to develop psychosis, those who receive omega-3 were less likely to develop psychosis, right? That somehow the fatty acids were making the nerve cells and the neurons work more effectively and to cope and not to progress with the disorder, right? And then there were also studies in people who were aging and who were starting to become a bit demented. And so for early stages of the dementia, it was like it showed up that omega-3 and fatty acids could be really beneficial to slow down the process a little bit. So, and then there were many studies in depression and anxiety, and some of them were showing that fatty acids could be helpful to reduce depression, or in people with depressive symptoms who didn't respond to antidepressants. It could be helpful for them to have like fatty acid supplementation. And then there are other studies in ADHD, for instance, and I was involved in one meta-analysis some years ago in which we showed that fatty acids and omega-3 could be beneficial in reducing symptoms of ADHD, which was very important for us because we doctors don't want to medicate every single child. We try to find any other ways of first of all understanding the disorder, and second to try to help without medicating, right? So they kind of compensate each other, and they help with oxidation processes in the brain and with maintaining the balance in the brain. But usually, what we talked about, the oxidation process, is maintained by these two, and also the membrane, how the membrane works, and how the neuron responds to certain like neurotransmitters and all that is depending on this. Vitamin D has been linked to depression, and we know that, for instance, in the UK, people, because they're not exposed to the sun that much, the vitamin D levels may be slightly lower, and that can lead to feeling tired and feeling depressed and all that. So sometimes when people feel slightly depressed, we recommend them to go and do this blood test to check that the vitamin levels are normal, and otherwise we recommend for them to take supplementation with vitamin D. Well, folic acid is very important for the brain development and is a component that is essential, especially during pregnancy. So women are encouraged to have this supplementation on folic acid, just in case that they don't have enough folic acid in their diets, because we know that prevents so many neurological problems, and the nervous system develops better. So yeah, very essential. Mind and body are not a different thing, right? So probably we tend to think like, this is mental health, this is physical health. That is not the case, okay? So our health is a global thing. And when our physical health gets resented, then our mental health gets resented, and vice versa, right? So by eating healthy, by exercising, by sleeping properly, what we have is like our body and our brain, there are a number of mechanisms that help both our brain and our body to be more able to cope with the stress and to with the stressful situations in life, and to be able to cope with mood problems, and to be able to cope with in general like things that happen in life.